So now, the final step in the process is to use one embryo and transfer that back into the perfectly prepared uterus so that the best chance of pregnancy results. Again, to review, the reason that we do it this way is because when the eggs are retrieved, there's a very high level of estrogen present circulating in the blood. In fact, it can be 20 to 30 times the amount that's present in a natural cycle. The uterus just isn't used to seeing this much estrogen, and the uterine lining doesn't optimally develop in every case to allow implantation to occur. By uncoupling the process of egg retrieval and embryo transfer, we're able to get around this. There are a number of different ways to provide estrogen to allow the uterine lining to develop perfectly. There's oral estrogen, there's skin patches, there's injectable, and sometimes transvaginal estrogen capsules. All of these things may be used in an individual basis. Sometimes we use several of them to achieve the proper result. This process is much simpler than the first process because the monitoring is only done once weekly, simply to measure the lining of the uterus and to make sure that an ovulation doesn't take place prematurely. Once we're able to document that the uterine lining has developed to the sufficient thickness, then we start the progesterone supplementation, and 5 days later we thaw out and transfer back our one embryo. Because we know the gender of all the embryos, this allows the couples who want to sometimes select which gender to replace. I've been surprised, however, at how many people don't want to know the gender of the embryos and allow us to pick that embryo and tell them at a later date. However they decide they want to do it works fine with us. Once that embryo is then thawed out and recovered and usually looks exactly like it did when we froze it, then it's important to get it in the right part of the uterine lining. Almost everybody uses ultrasound guidance now for embryo transfers, and about 10 or 12 years ago we started using this as well, and we also started using it in a different way. Most ultrasound guidance, I think, is done with transabdominal ultrasound probes, and we've never done it that way. We've always used transvaginal ultrasound probes. We can see much better this way. I can tell exactly where the tip of the catheter is with respect to the top of the uterus in a very clear image, and we know that that embryo is going to end up in the perfect location to provide the optimal chance of that embryo to implant. Once the embryo has been transferred, we have the patients on some bed rest for a couple of days, usually 2.5 days of bed rest, and another 4 days after that where they just kind of stay home and take it easy. And they limit some activities like exercise, caffeine and alcohol, overheating their bodies, things like that. And after 10 days, we're able to do the pregnancy test, which in our hands with women under 40 is positive 85% of the time. So we feel that the transfer of one embryo and achieving one baby is definitely something that's a possibility today because of the result of a number of changes in the field that have taken place over the last 5 to 10 years. But it's also important to use these technological advances in the proper way. And I think that the way that we've talked about using them over these 3 videos documents exactly how that's done.